A man with full-blown AIDS is hospitalized for a week with a minor infection.
He's in the hospital because he's not feeling well. He goes in, he ends up with Candida or yeast infection in his mouth and his esophagus, and they tune him up.
But only hours after his release, he collapses suddenly and dies.
The paramedics all around him. They say he stopped breathing on his own.
Did the hospital miss this man's killer?
I don't know how well they treated him. How well did he get over? Did they miss something at the hospital? I mean, he'd just gotten out.
She has a full docket of unexplained deaths waiting for her in the morgue. Case today is a 45-year-old man named Ricky Hawthorne, who died suddenly yesterday evening.
Well, today we have a local bar and collapses off his bar stool.
Dr.G's investigator's report also states that only 1 week prior to his death, Ricky was hospitalized with intense pain.
We know a week earlier he'd gone.
During his hospitalization, Ricky is treated for a fungal throat infection, but doctors detect no other medical problems.
They test him from his head to his toe.
Six days after being admitted for treatment, Ricky is well enough to be released from the hospital. Before leaving, he receives a flu shot and then returns to the home he shares with his sister, Carol. But he doesn't stay long.
He was impatient.
Only hours after leaving the hospital, Ricky walks to his neighborhood bar to visit friends. It is the last time his sister Carol will see him alive. Carol rushes to the bar and finds her brother strapped to a stretcher. Ricky is rushed to the hospital in full cardiac arrest, but after numerous attempts, doctors are unable to revive him.
To do with acute alcoholism. I don't know how much he was drinking that day. I mean, he could have fallen off the bar stool associated with being drunk and then broken his neck. Something to do with his crack cocaine habit, something to do with his AIDS, certainly. He certainly wasn't well controlled. He didn't like to take his medicine. It certainly could be some natural disease. I don't know how well they treated him. Or did they miss something at the hospital? I mean, he'd just gotten out. Maybe it has nothing related to his hospitalization. Maybe it does. Maybe they released him too soon. I don't know.
And Ricky's sisters have their own suspicions. They worry that since Ricky suffered from AIDS, he should not have received the flu shot at the hospital and fear that it may have provoked a fatal reaction.
And they're worried that
if Ricky had received this vaccine, there would be cause for concern. However,
well, I'm viewing the body. He looks like very thin, not very well cared for man. He looks older than his stated age of 45. And he had reported that he had recently lost a lot of weight, which is not unusual. If you have AIDS and you don't want to take your medicine, you're going to get a wasting disease. I mean, I see numerous small scabs on him, and they're in various stages of healing. He looks just very unkept. They look like bug bites, or some of them look like they might have been healing scabies. It's just his general kind of unkept look to him. And he still had his hospital tag on his wrist. He never bothered to take it off. I mean, he was just released before he died.
Dr. G notes the personal items found on Ricky's body by her death investigator: a condom, candy, spare change, and evidence of his cocaine habit, a glass pipe. She also notes the stabilization collar around Ricky's neck, a precaution taken by the ambulance crew in case Ricky broke his spine in the fall from the bar stool.
Can we get this off of here? Here, I think I can just get it. Okay, thanks. Very distended neck vasculature. We can see the veins in his neck are very prominent.
However, after a thorough external examination, Dr. G finds no clues as to the cause of Ricky's sudden death. Apparently, the key to his killer lurks somewhere within. But if so, why did the hospital miss it?
I didn't know if they'd missed something or not.
Only hours after being released from the hospital with a minor throat infection. Cocaine abuse. And in Ricky's case, this is a real possibility. Did Ricky Hawthorne's drug abuse cause the fatal clot to form? Or was it simply a tragic, natural event? Clot caused by cocaine abuse.
Talking about acutely using cocaine, which sets up the process for him to have that thrombus, I will call this an accidental death. We know that he was under the influence of cocaine at the time he died, and we know that it was used very near the time he died, within hours.
Despite a long list of suspects, AIDS, trauma, neglect, or natural disease, ultimately, it was drug abuse that killed Ricky Hawthorne. A week before his death, Ricky Hawthorne, a man suffering from AIDS, is hospitalized with intense pain.
When he comes in, he's complaining of abdominal pain, some questionable chest pain, and not being able to eat. And they do, extensive workup.
After a week of treatment for a minor throat infection, Ricky is released from the hospital. That evening, he visits friends at a local bar.
We don't know what happens, but we do know he goes to the bar probably at least sometime about 5 o'clock. Sometime in those between 5 and 10, he's using cocaine. It sets up a process of some coronary artery.
Yo, can I get another one? Sure. Just a minute.
And then what happens is his heart gets very irritated. He's on cocaine, which is in and of itself can cause arrhythmias. Now part of his heart isn't getting blood. The blood clot isn't allowing blood to that part of his heart, and it can't pump. And he's getting no blood to his brain, and he passes out.
Ricky falls from the bar stool and his heart goes into cardiac arrest. The damage to his heart caused by the cocaine is irreparable.
They can't bring that heart back because that heart is dying.
Ricky, what's wrong with him? No, let him work on him.
There's no blood going to that part of the heart, and he dies on his way to the hospital.
For Ricky's... In other words, Dr. G believes that Ricky's heart, in all likelihood, would not have killed him if he had not used cocaine.